Welcome to another Petoskey Strong Community Conversation Focus on Health. I'm Nikki Devitt with the Petoskey Chamber, and I'm joined today once again by Dr. Karen DenBesten, the Infectious Disease Specialist at McLaren Northern Michigan. Thank you for joining me again, Dr. DenBesten.
Great, thanks for inviting me, Nikki. I'm glad to get the word out.
We've got a lot of words to get out. Here we are, nearly a year since our first cases of COVID in our area, and we're still moving forward, and we're moving forward. Let's start off with that. Vaccines, case count, everything. We are so much better than we were just a few months ago, but we're not done, right?
Correct. I think there's a lot of reason to be optimistic. Vaccines are rolling out. The vaccines that are currently available, the Pfizer, the Moderna, and now the J&J vaccine, spectacularly effective in preventing serious illness from COVID. And there's good emerging data to show that the vaccines prevent transmission as well. So there is definitely light at the end of the tunnel. Over the last month, we've seen nationwide our cases of COVID stabilize and come down for the first time in a long time. So there's a lot of reason for optimism, but we're not there yet. We do know that there is widespread COVID transmission in the community, and we're seeing these mutant strains come through that are more contagious and potentially more deadly than the strains that we're used to. So we certainly aren't there yet. There is need for caution and vigilance, but there's light at the end of the tunnel. If we can double down, we can get there.
And doubling down means getting your vaccine, signing up if you are in a group that is ready to, which just yesterday, 50 and up for our region, which is absolutely huge, as well as some service industry workers through the tribe are able to be vaccinated through that health department as well. So that's a big deal. So one, sign up for your vaccine. And if you're in a group, get it. That is so vital. Get it. Get the vaccine.
Absolutely. As soon as vaccine is available to you, don't wait, get it. Get whatever vaccine you can. These vaccines are very effective, they're safe, and this is the way out of the pandemic. This is the way to get our life back to normal. People might think that they don't need the vaccine if they're not necessarily a high-risk group. This isn't true. Everybody should get it when it's available so we can prevent further transmission and further mutation of the virus. If we can prevent spreading the virus, then we're going to prevent resistant or strains from emerging, and we'll get through the pandemic. But everybody needs to get immunized,
and everybody needs to continue to wear a mask. Let's talk about that. That's it's been in the news that some states are recalling their mask mandates and leaving it up to individuals. And let's just talk about the fact that it's not just the vaccine that will get us open as we want to be. We want to reopen our economy. We want to re-engage our community. More than anything, as human beings, we need each other. We need to have a functioning economy. But to do that, we still need to wear masks and distance and safe practices.
Right. We want to get back to some semblance of normality. Everybody wants human contact and business to be open, and we can do that and we can get there, but we can't ditch the mask yet. I see some states that are throwing out the mask mandate, and that is an incredibly foolish mistake. We still have very high levels of COVID trending in the community. We know that masks work and they prevent transmission, so it's just insanity that we would get rid of the mask now. You're just asking for trouble and you're asking for more deaths. By wearing a mask, we're able to get out and do the things that we want to do, having some confidence that we're going to prevent the transmission of COVID. So we're not there yet. There are not nearly enough people who have immunity to COVID to get rid of the masks at this point. We know they work. Now is the time to double down. If we can do this and double down and wear the mask as immunizations roll out, I'm very hopeful if we do it, that we can get through the summer and have some sort of a normal school year next fall if people do what they need to do at this time.
And that's the key to it, is doing what they need to do at this time. We are grateful and excited for the opportunities that we're seeing to start to reopen things, restaurants a little bit more, retail a little bit more, outdoor gatherings a little bit bigger. But all of those come with the caveat that still wear the mask, because as you said, COVID is still in our community. We're still seeing cases. That hasn't gone away and won't for some time. So we need to be cognizant of that, correct?
Yes, I mean, COVID is still here. It's very good news that the businesses are opening up. In-person dining is opening up to higher capacity. That's all very good for the businesses and the community, but we are going to see increased cases of COVID transmission as a result. So whenever you can wear that mask, you should. If you're going into a restaurant, wear the mask in, wear the mask out. Just when you're eating, take it off. I mean, some common sense here goes a long ways. We know how the virus is transmitted, and we know how to prevent the transmission. So the more things we do to intervene, the safer we're going to be and the less transmission we'll see.
And let's talk too about when we talk about community transmission and the exhaustion that we know people feel with wearing masks, with not being able to do all the things you want to do. The importance of it is that while you may contract COVID and not get sick or not get really sick, it doesn't mean that you're not exposing other people in the community who could die from COVID. So we have to kind of step back and remember that no matter how old we are, no matter what age, that, it's not just about us, it's about our community as a whole.
Absolutely, especially in the younger population. We know that they are at lower risk for getting seriously sick from COVID, and really it's unheard of for younger people to die, although it can happen from COVID. But the older people or those with comorbidities and other illnesses are at higher risk for death. So that's the reason why we're wearing the mask, to prevent the transmission and to prevent spread to people who are very vulnerable who can die from COVID. So, you say to the teenager, they're concerned about getting COVID because it means they're quarantined out, or maybe they can't go to a certain sporting event. But really, the reason they should be wearing the mask is to prevent the most vulnerable in our community from dying and getting sick and dying from COVID. In the United States, we're talking over 500,000 deaths we've had so far from COVID. So far, it's still going up. 500,000 people. I mean, there's an incredible amount of just pain and suffering and grieving in the country right now. And people don't see it unless they, know somebody maybe that got sick and died from COVID. But we're talking about 1 in 700 Americans dying from COVID. We've had 50 deaths, almost 50 deaths here at the hospital in Little Petoskey from COVID. I mean, the amount of suffering and pain and death in the community is just staggering. So that's why we're wearing the mask, to protect that vulnerable population. So your actions definitely do save lives if you wear the mask.
And it's not just about saving lives, it's also about all of those in our community, our state, and our country who survive COVID and are faced with long-term effects and effects we don't even know yet. Returning to normal. And I know many people my age who, said it was horrible, but gosh, I still feel this way. And it's been 6-7 months. And so
that's the other thing that we're really beginning to realize. These long haulers, people that have had COVID, is not a benign illness. Some people may, not even realize they have COVID and recover from it, but a significant number of people will have really bad symptoms that just won't get better. These long haulers, continued fatigue, shortness of breath, depression, it goes on, brain fog. And you certainly don't want to get COVID. It's not a benign illness. And these long haulers can really get sick and have symptoms for months on end. Again, a good reason not to get COVID and an excellent reason to get your immunization.
Get your immunization, wear a mask. And speaking of, I wanted to touch on this too. There's been some talk a little bit that you hear with the J&J vaccine because its efficacy is lower, but it's a single dose, but you still have the 0 death from the studies. There's talk that it's a second class vaccine. And so if you sign up for a vaccine and they say, well, you got J&J, understand that it's still a vaccine, correct?
Yeah, the Johnson & Johnson, the J&J vaccine coming in 3 months later to C-, right? 72% efficacy. I'll take it. That's still very good for vaccines. That's great. The nice thing about the J&J vaccine is that it's just one dose and done, one and done. So you don't have to come back for that second dose. And it doesn't have to be kept at like super cold temperatures like the Moderna and the Pfizer vaccine have to be kept at. So it's really a very good vaccine to have available. It is approved for 18 and up, but there are ongoing studies for children that are underway. So I'm hopeful that the J&J vaccine will be good for kids and teenagers ultimately if we get that data back over the summertime and into the fall to get kids immunized.
And, remembering that too, that Pfizer and Moderna are 16 and up too. So once we start seeing that in our youth, that will help that, community spread as well, and allow our youth to get back to living the life they want to live. And then they, by all means, deserve to live and have a full childhood and experience everything that we all experienced. And so all of this is incumbent upon everybody looking out for everybody else, right?
Right. Actually the Pfizer is age 16 and up, and the Moderna is 18 and up.
Okay.
And right now the J&J is 18 and up, but ongoing studies, like I said, in kids. So I would encourage, once Pfizer becomes readily available over the summertime or late spring for everybody, teenagers, college students, absolutely get that vaccine. This is going to be, people talk about your immunity passport. This is the way to get back to normal. At some point, I foresee, in order to be able to participate in certain activities or in order to travel, you might have to show proof of immunization at some point. So this is the way out, is to get everybody immunized.
Absolutely.
When it's your turn and as it becomes available.
I know my soon to be 16 at the end of the year will be more than happy to have that immunity passport to be able to return to as much normal life as possible. How is everyone at the hospital? That's something we want to know as a community. How are you? How is our staff?
Staff is good. I think morale is good. People are much more optimistic now that we've had an overwhelming majority of people immunized here at the hospital. I think we had 70% of the people immunized here at the hospital, employees. Our numbers of COVID have gone down. Right now we have, I think, 3 patients in the hospital in the respiratory isolation with COVID. Though that's down from our highs at the end of November of like 30 patients. It was just exhausting. So I think there's a lot of optimism here, but there's a lot of caution too. We remain very concerned that spring break is coming up and we're seeing these mutations that are coming around in the community. The B117 strain from the UK that's more contagious than the variants that we're used to. This coupled with the fact that in-person dining's open up, high school athletics are going on, and spring break's coming up. Very concerned that we're going to see a third wave here and get overwhelmed again. It can happen in a blink of an eye. So we are kind of holding our breath. And I'm concerned that we could see another spike in COVID cases, but right now we're doing pretty good. Things are looking good. We have, seems like the number of staff that are out sick is very low. So we have plenty of personal protection equipment. We have the ability to care for patients, some new therapeutics that are available. So I'm very optimistic here. We have the ability to take care of COVID patients. Good capacity, both COVID and non-COVID patients here at the hospital. But I would urge caution, and vigilance as we go into spring break. There are ways to go out and enjoy your spring break, but still stay safe.
Yes.
At this point, we know how it's transmitted, and avoiding those types of activities that transmit the virus is what we need to do. You can go on spring break, but stay away from large gatherings, wear your mask, etc.
Right. And as you said, it can turn on a dime, and we've been there before. And from a community business standpoint, we saw the effects that had on our businesses and of being pulled back extremely again. And, one more time, we have to stay safe to stay open. We owe it to our businesses. We owe it to the employees in our community. We owe it to everyone to make sure that we're smart right now. And like you said, in-person dining is open. That's fantastic. Just don't take your mask off while you're walking around going to talk to somebody. You shouldn't be doing that. The business doesn't want you to do that. They want to stay open. And if you're going to go see people on spring break, like you said, watch the large gathering. It doesn't mean that you can't have, grandma over finally for dinner and, keep the masks on, be good, be smart. And, that will keep us from rolling back, which what we want to do is we want to keep going forward, not backwards. So good. Very good. Anything else you have, Doctor?
I'd just like to point out that we're not there yet. There are a lot of worrisome signs. There's a lot of COVID in the community, but we know what to do. Wear our masks, get our vaccinations, and there definitely is light at the end of the tunnel. And I think most infectious disease physicians, I think, remain pretty confident that we can see the light at the end of the tunnel at this point if we continue to double down and get our immunizations.
Absolutely. And we appreciate your time, and we'll definitely be talking again. We know that, as you said, we're not done yet, and we want to make sure that we keep everybody informed. And as always, I appreciate you taking the time.
Thank you.